Hello everyone, welcome to the final week of putting Dr. G on the spot in the month of May while talking about swelling in the testicle. So we have gone through quite a few, talking about fluid in the testicle, veins in the testicles, and various other things such as hernia. But this week, we're going to talk about the swelling in the testicle itself due to infection called epididymo-orchitis. The name itself, epididymo-orchitis, actually is a bit of a mouthful. Actually, it means that the two parts of the testicle is affected. The testicle has the testes part where it makes sperm and the maturation of the sperm happening in epididymis. So if the epididymis get infected, the testicle itself also get infected, resulting in epididymo-orchitis. How does that happen? In fact, typically we realize that men below the age of 40, most of this is due to either sexually transmitted or hygiene. So for example, if somebody contracted chlamydia or gonorrhea, ureaplasma or mycoplasma, initially it started in the urethra, resulting in something called urethritis. If this is not solved with antibiotics, then it gets backtracked into the prostate and subsequently get into the testicle, resulting in epididymo-orchitis. Epididymo-orchitis is excruciatingly painful. It will cause swelling in the testicle. Sometimes it may even result in abscess that ended up for you to lose your testicle with a surgical intervention called orchidectomy. However, if this is treated early with the appropriate antibiotics, therefore you need to tell your clinicians that you have some suspicious or high-risk behavior that ended up with STI, then the appropriate antibiotics can eliminate all these problems. In the older men, if you don't empty your bladder completely, then you might get infected with a common bacteria called E. coli. E. coli will get retained in the urine and get backtracked into the testicle, resulting in epididymo-orchitis. If that happens, sometimes it can prolong into a chronic epididymo-orchitis, resulting in constant pain, and sometimes might end up needing an operation to remove part of the epididymis called epidydectomy. You know that the testicle itself, although it actually serves its function to produce the testosterone and also sperms, however, it is quite vulnerable to infection. Therefore, make sure that you have low risk of sexually transmitted infection. And when you empty your bladder, make sure you empty it all completely. Otherwise, the testicle and its surrounding tissue might get infected. For the next month of June, believe it or not, we're moving into the month of June. It is the month of Father's Day. What better things to talk about is contraception. Stay tuned and carry on putting Dr. G on the spot.